Did you know where you live can impact how long you live and how healthy you are? It's called social determinants of health, and we're going to talk about it right now. This video on social determinants of health is part of a larger playlist on community and public health nursing. In this video, there are a few different learning goals that we have. I want you to be able to list the 5 social determinants of health, explain how these social determinants of health affect health for both individuals as well as for communities, identify patients most at risk of being affected by social determinants of health, identify public health initiatives and policies that try to address these social determinants of health, and then finally talk about what's our responsibility and collaboratively as medical personnel, identifying nursing and collaborative interventions to address social determinants of health. So let's get into it. According to the CDC, social determinants of health are non-medical factors that influence health outcomes. They are the conditions in which people are born, live, work, learn, play, worship, and age, and are the wider set of forces and systems shaping the conditions of daily life. And specifically, there are 5 social determinant of health categories: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. And in this video, we're going to break down each one of these social determinants of health. So make sure you're taking notes as we go along. The first social determinant of health is economic stability. In other words, does someone have the basic resources needed just for regular everyday life? Income, housing, transportation, and food. And there are a number of factors that can impact economic stability. And these include things like employment, access to food, transportation, and housing. Let's talk about each of these impacts separately. In terms of impact, it's important that people have employment that is reliable, that provides a living wage, and often it's a way that people get insurance in our company through employee-provided healthcare insurance policies. But this can lead to some issues where healthcare policies are really expensive. And so there can be people who are underinsured, meaning that they only have major medical insurance for major life events, but they don't have good insurance just for everyday health. And we can see something called CHIP. And CHIP is a Medicare-funded program for children who are 19 or under, whose parents make too much money to qualify for Medicaid, but can't afford private insurance. So we can see underinsurance and CHIP being issues. Food can become an issue. Food deserts are areas where there is no access to healthy food, and people have to travel very far to resource themselves with food. Food swamps is there's food available, but it's all garbage. There's fast food on every corner and convenience marts, but there's not a lot of fresh fruits and vegetables, so it makes eating healthy really difficult. And food insecurity means people don't know where their next meal is coming from, which can be a huge stressor in someone's life. Transportation is another sign of economic stability. Looking at communities to see whether they're bikeable and walkable and that people can get around easily. Looking at personal vehicles. Do people own their own cars? Personal vehicle ownership is extremely expensive. It's actually the second most costly household expense, second to housing. What's the public transportation system like? There are some areas where public transportation is pretty easy. They have light rail and buses, but then there's other areas where it's really hard to get around if you don't have your own car. Is the public transportation ADA compliant? Are the sidewalks ADA compliant and easy for people to get around with disabilities? And finally, are there medical transportation partnerships in the community? For example, some of the rideshare partnerships have partnered with local pharmacies to get people to and from their flu and COVID vaccination trips free of charge. A final impact of economic stability is housing. And we're going to talk about housing more as we get to the neighborhood and built environment, so we're going to table that one for now. It's important as nurses that we identify risk factors for problems with economic stability, and these can be for individual patients or communities as a whole. For individuals, risk factors for problems with economic stability would be low-income earners, people who have unreliable income, maybe it's seasonal or maybe it's just as needed, patients with disabilities who may have hard time getting or keeping a job, patients with unreliable childcare, so they can't show up for the job that they have, racial minorities, and patients who are on Medicaid and Medicare. And then in terms of community, we need to look at communities in terms of housing costs. Housing costs have been rising, and it's causing a housing crisis because people can't afford to live in their community. And the second is unemployment rates, because unemployment rates leads to economic instability. There are a number of initiatives and policies in place to improve economic stability in communities and for individuals. SNAP provides food for low-income families. WIC is similar. It's for women and children under 5, and it again provides allocations of food to ensure nutrition for women and children. The National School Lunch Program is very popular and gives free or reduced cost lunches to children at public schools. And then finally, it's important to recognize that all of these programs are just about feeding people temporarily. But what really needs to happen is a focus on anti-poverty initiatives, pulling people out of poverty rather than just anti-hunger initiatives. So what do nurses do? Well, we need to assess for patients at risk of economic instability. We need to know about and connect our patients to local resources, and we need to advocate for change, especially as it comes to anti-poverty initiatives for the community. The second social determinant of health is education access and quality. Quality education meets national standards and benchmarks. It has good student-to-teacher ratios, school nurses and other ancillary departments, and school programming and after-school programs. Patients who do not have access to good quality education can experience bullying, lower graduation rates, they're less likely to go to college, and then less likely to get well-paying jobs. They're at higher risk for chronic diseases like diabetes and coronary vascular disease. They're at higher risk for mental health disorders. The stress from poverty can cause decreased growth and brain development, and they're also more likely to have a shortened lifespan. So you can see that education really impacts all areas of life. Now, there are risk factors that we should be aware of in terms of education access and quality. For individuals, we want to look at teen pregnancies or students who are truant and missing school a lot. And then for the community, we want to look at lower homeowner rates and higher poverty rates, because in America, education is tied into property taxes of the local community. So the lower the property taxes in the area, the lower resources that school will have. There are a number of initiatives and policies built to address the social determinant of health. The first is the nurse-family partnerships. The nurse-family partnerships have been around for over 45 years, and they have a combination of both private and federal funding. And they have an incredible track record of improving a variety of public health initiatives with young mothers and children. Specifically, they've seen a reduction in child abuse and neglect, reduction of ER visits for accidents and poisonings, reduction of language delays, reduction in behavioral and intellectual problems at age 6, fewer subsequent pregnancies, and fewer arrests of the mother. So this initiative brings home health nurses to the new parents during pregnancy and helps these nurses follow the patient through the first 2 years of their child's life. Teach for America is a program that brings qualified teachers into underfunded, struggling schools in exchange for loan forgiveness on their student loans. And again, here, the goal is really breaking the cycle of poverty to increase wealth in the community to have better education. Third area is healthcare access and quality. Individuals' access to and understanding of health services and their health is the focus here. This can include things like preventative service, screening, specialty care, medications, and primary care. There are a number of things that can impact someone's access and quality of healthcare. And these include things like health literacy, availability of providers, and insurance. Health literacy is the patient's ability to understand and use health information provided to them by clinicians and nurses. When a patient has good health literacy, they're able to adhere and follow the treatment plans. When a patient is unable to understand the information provided, you're going to see adherence issues, which means patient outcomes will suffer. Primary language can be a key factor here in health literacy. It's important that patients have information provided to them in their preferred language. Availability of providers is the second issue. Patients need to be able to access their healthcare. And so they need to be able to have transportation to and from their visits. They need to have specialty physicians in rheumatology and cardiology and pulmonology in the community where they live. But unfortunately, in rural areas, a lot of specialties don't exist, and they might have to travel to a major medical center to get specialty care. In addition, many types of providers these days have waiting lists. And so we can see patients come in who are really sick and they can't even get into their doctor for 6 weeks. The final issue here is insurance. In America, we do not have universal health insurance, which means it's really on everyone to figure out how to get their own insurance. And so we have issues like uninsured patients who have no insurance, underinsured patients who maybe can only afford major medical insurance. Major medical insurance really only covers you if there's a major disaster, car accident, that sort of thing, but it doesn't cover your everyday services. Medicare is another aspect of insurance, and Medicaid, both federally funded, as well as CHIP, which is for lower income children. We're going to talk about each one of these separately, so hold on. Now, risk factors to healthcare access and quality include being unemployed, because then you don't have access to insurance, being disabled, because it's hard to keep a job, being under the poverty line, being uninsured or underinsured, or having public insurance, which has its limitations. There are a number of initiatives and policies that have been built to help address this social determinant of health. The Affordable Care Act of 2013 helped to increase and expand coverage to millions of more Americans. CHIP is the insurance for children whose parents do not qualify for Medicaid but can't afford private insurance. We've seen an expansion of Medicare to qualify more people, including people with disabilities and end-stage renal disease. And there's ongoing advocacy for universal health, that people bring up the question of, is healthcare a human right, or is it something you should have to pay for? And then finally, nursing interventions are to assess people's access to healthcare and to connect them to resources in the community. The next social determinant of health is the neighborhood and built environment. This is defined as individuals' housing, neighborhood, and environment. This can include things like water and sewage systems, environmental or air pollutants or poisons. What's the crime and safety rates like? What are the parks like? Do they have playground equipment? And are they clean and are they safe? And what does the state of the buildings look like? Now we can kind of break these into two areas: air and environmental pollutants or poisons, and parks and safety. Now, if we think about air, environmental pollutants or poisons, these poisons and pollution can actually impact health in a variety of ways. The most notable being heart and lung disease, cancers, and asthma. And when we look at a community's parks and safety, we want to consider availability of parks and playgrounds, and are they safe for kids to go and play at, which can really have an impact on physical activity and stress and mental health. Risk factors for neighborhood and built environment include high crime rates, blight, meaning buildings and yards that have not been kept up, factories, which can increase pollution and exposures to toxins, and old buildings built before the 70s, which can have lead in the paint. Initiatives and policies around neighborhood and built environment can be things like the Safe Drinking Water Act of 1974, individual building codes of cities to make sure that buildings are safe and built correctly, the Toxic Substance Control Act of 1976 to control poisons and toxins in the environment, the playground building. So there's a not-for-profit called Kaboom that goes into underfunded areas and mobilizes the community to build playgrounds in their parks. And then OSHA, which is the agency of the government that helps to maintain safe work environments for workers. Nursing interventions related to neighborhood and built environments include participating in local cleanup days and playground builds, completing a windshield survey of the community where you serve to really get a sense of what the community's needs are, completing lead screenings for children to make sure that lead poisoning is not an issue, educate parents about toxins and making sure that they're storing household products safely. And for occupational health nurses, their job is to educate, screen, and protect their employees. Finally is the social and community context. Healthy interpersonal relationships at work, school, and play are so important for health and wellness. This includes things like family dynamics, community programming and events, mentorship, and support groups. So the impacts of social and community context are things like social support, social cohesion, meaning fitting in, community engagement, equity, and incarceration. Social support, things like friendships, activities, and social networks are such an important part of our mental and physical well-being. Social cohesion is a sense of belonging and a sense of community. Community engagement means that are there things going on? Are there events going on at the park district and at the YMCA and things to get involved in? Equity, is there a equal share and distribution of resources in the community? And finally, incarceration. Youth who have a parent who is incarcerated are at much higher risk for having social determinants of health. So risk factors for social and community contexts in the community itself is look for a lack of community resources or programming. There's no community center, or there's a lack of mentorship programs. And as for individuals, look for parents who are incarcerated, if patients are isolated, or if patients are displaying signs of being a disconnected parent. Initiatives and policies include things like the Boys and Girls Club, which helps to reduce gang violence, and there are support groups for a variety of different needs in the community, caregiver support specifically, caregiver support, divorce support, domestic violence support, and so on. Community centers provide a lot of daycare options and community programming through different park districts, and then religious centers often have community programming and outreach as well. So our job as nurses for social and community context is to assess for risk factors and to connect the services. The job of the community health nurse is to really know what your local resources are, assess for risk factors in your patients and community, and be the connector between the resources and the patient. Thanks for listening. As always, remember, you are smart, you are capable, you are loved, and you've got this. I'll see you next time.